When does progression start? Now. Until now, the insidious, gradual, progressive change, absent of relapses and occurring from the start of multiple sclerosis, has not been recognized. But in fact, progression of disability is a combination of numerous pathological processes. Acknowledging this blurs the lines between the clinical manifestations typically associated with RMS and PPMS. In fact, in patients with RMS, there is an often unseen accumulation of disability occurring independently of relapses. The example here shows a patient who has only experienced 3 relapses within a 10-year period. In the background, the disease continues to gradually advance and impairments gradually increase. Disability may not even be reported until it surpasses the clinical threshold, where it is acknowledged by the patient and their doctor, making disease severity and stage difficult to pinpoint. And because progression is present from the start, a point most experts agree on in research, the earlier use of highly effective therapy could positively impact long-term clinical outcomes. Now is the time to look at MS disability progression in a completely different way. Right from the start, disability progresses in 2 ways, associated with relapse or independent of a relapse. Relapse-associated worsening, or RAW, is easily detected because patients with an unexpected and abrupt change in symptoms that continues for more than 24 hours, defined as a relapse, often report the change to their care team. Unlike RAW, disability progression independent of relapse activity, or PIRA, is often not reported since it is gradual and only clearly evident over longer time periods. And over 75% of disability worsening documented by objective examination in clinical trials is a consequence of PIRA. Detecting PIRA and recognizing that the majority of disability worsening in early relapsing forms of MS occurs independently of relapses helps us to see progression in a new way. How can PIRA be detected and measured to allow it to be seen? One way is by looking at a composite of clinical assessments of performance and disability rather than a single, less sensitive endpoint. PIRA is defined as any change in EDSS, 9-hole peg test, or timed 25-foot walk. A rebaselining is performed approximately 30 days after each defined relapse has occurred. At subsequent time points, it is determined whether or not the patient has had a significant change in disability compared to the rebaselined level. The use of a composite measure is critical in recognizing disability worsening that is often overlooked early in the disease. Here is a breakdown of the contribution of PIRA versus RAW events to disability worsening. By addressing multiple sclerosis effectively from the start, we can get ahead of progression.